Welcome everybody back to J3 University Podcast. With me today is, of course, co-host Luke Miller. Luke, how are you doing, buddy?
Good, man. Ready to rock today.
Right on. And also with us is Dr. Jordan Shallow, chiropractor and performance coach, founder of Prescript, and coach for Elite FTS. Jordan, how you doing, man? It's great to have you on.
Yeah, thanks for having me on. Looking forward to this.
Yeah, the topic we wanted to have you on, which is really your specialty, is, of course, just the assessment and session preparation, string into program setup for specifically bodybuilders. So before we even touch the basics of programming, like how much volume do you do or how many sets should you do? Like, how do you move? Are you moving appropriately to even get into these positions to do these functions? And even if you are in these positions to execute a squat or a hack squat, maybe it looks right, are you even having the proper neural patterns to activate the muscles that you want to? And this has been an issue that I run into almost everyone that I coach, is someone has some type of level of dysfunction or mobility issue. And I can see them look right, but then there's all these asymmetries present in bodybuilders. I've had them myself. It's like, gosh, I'm trying as hard as I can. I'll do unilateral movements and everything looks right, but I'm still like not having this equal growth in tissue. And there has to be something more. And maybe it's neurological, maybe it's from injuries. And so that's what we want the expert here for, to dive into and just kind of answer some of this stuff for us. So I think like a great starting point would be getting to just presenting your mobility, stability, strength model, trying to set up those definitions, and before we get into what do we actually do once we're seeing these problems, and before moving into program design for individuals.
Yeah, so like mobility, stability, strength is like a model. I don't know if model is the right word. It's kind of like a prerequisite system. Listening, and this is where things get a little bit contentious, like understanding stability as a separate adaptation, I think, is something that often gets lost in the quantitative weeds of strength training and sports performance and things like that. And fundamentally, it's when people don't have a working understanding of how the central nervous system works. We like to reference the central nervous system just haphazardly, and we just like kind of close our eyes, because we can map like a bicep origin insertion, and we can toss out like a coracoid process here and there, and we can sound smart, but unless you want to really dive into like mapping the central nervous system, a lot of people have an issue with that model because they don't understand stability as a separate adaptation in the body. So I think range of motion and mobility, understanding the difference between mobility and flexibility, I think, is important. Understanding that flexibility is passive, mobility is active, right? And as bodybuilders, as I'm assuming that's the audience that we're going to be speaking to, like, the principle of active range is something that often comes up in bodybuilding circles, like understanding when to train within or without your active range. And I think to have that conversation devoid of the conversation of like, internal versus external stability, structural versus functional stability, I think is kind of a moot point, right? So like, should you go outside of your active range when you squat? Probably not. Could you go outside your active range with a leg press? Yeah, probably. What's the difference between those two exercises? Well, one is externally stabilized by the leg press that you're sitting in. One is externally unstable because it's just you and a barbell and gravity, right? So mobility, I think, is something that when we look at it in bodybuilding terms, we denote it as our active range of motion, right? This is kind of born out of that RTS, Tom Purvis, real kind of strength curve resistance profile, which I think has its merits. But I would say that's very much in part a mechanical model and not necessarily a biomechanical model. So understanding range of motion or mobility as being your active range of motion, and then the active range of motion will advance you into relative joint positions that become structurally unstable. Like if I were trying to dislocate Luke's shoulder, the first thing I would do is put his arm over his head, right? Because now the articulating surface of the humerus and the glenoid has less of a structural stability, and now in turn is relying more on his functional stability, right? So stability can subdivide through internal and external, which is the example of the leg press and the squat. And stability can then from the internal break up into structure and function, which would be, bones on bones, more inert passive structures. And then we have like our more active structure, their active constraints. In this example with the overhead position, the rotator cuff probably being the primary, and to a certain degree, like the bicep plays a role in stabilizing the shoulder. The lat plays a role in stabilizing the shoulder, depending on the force vector. The tricep and the deltoid can play a role in stabilizing the shoulder. So I think when we get into stability, it's understanding that stability now becomes our ability to resist force, right? We conflate this with strength a lot of times in the way that we practice rehab, prehab, warm up, activation, priming, insert, whatever bullshit term you want. And we think that they're the two in the same, right? So we think that, you know, it comes down to the language. How many times as a clinician, I've heard people come in saying that I have a weak rotator cuff, I have a weak core, I have weak glutes. And it's like, but sure, does it matter? Like, does it matter that your glute med is weak? Like, does it matter that you can't do fucking clamshells with a band around your ankle? Like, probably not, because those muscles aren't oriented in a way where they need to necessarily exert force, right? That's not how they function. Like when you walk down the street, you're not fucking kicking your legs off to the side, just abducting into infinite space. It's like, what the fuck why do we do that? And we think that's going to work. So adding resistance to build strength rather than scaling center of mass and base support to build stability is something where I think a lot of people miss the boat in conventional models. So they'll go to something like a clamshell, like a rotator cuff external rotation isolation exercise, which isn't to say that those remedial exercises of strength, training a muscle through its action from insertion to origin, don't have its place. But long term, if we need to be specific, and with bodybuilders, specificity should be our aim. A lot of times bodybuilders just chase arbitrary novelty, right? They chase novelty, like, I don't know, we're gonna rest, pause, drop, superset. And it's like, what the fuck? Is like, you just throwing shit to see if like maybe something new will come out of this. I don't know. And let's do it with occlusion bands. It's like, for fuck's sake. And they've applied this like throw shit at a wall and see what sticks to their rehab, prehab, priming, whatever. And they get left like they're one track minded in training a muscle's function. They go, well, if my bicep is weak, I train it from insertion to origin, going through some level of elbow flexion, supination, and shoulder flexion. And I do that against resistance and it gets stronger. I know my biceps are stronger when I train that way. So my rotator cuff needs to get stronger. So they move it from insertion to origin, right? Depending on which particular part of the rotator cuff they're attempting to isolate. But when we look at like shoulders, hips, spines, and in a deeper conversation, rib cage and pelvis, it's not about isolation, it's about integration, right? So it's not about training the muscle's action in isolation by adding resistance to build strength. It's about training a muscle's function in integration to build stability, right? And that's where the model, so that's the cornerstone of the model, is that's really where the nervous system is going to derive that specific adaptation. And if you wanted to dig a little bit deeper into that, you would look at muscle spindle pathways, dorsal spinal thalamic tracts, and ultimately the cerebellum is where anything under the sphere of athleticism is going to really reside in, primarily in the brain. But for all intents and purposes, stability is our ability to resist force, and to understand that and how much we gradate that stimulus, it ultimately comes down to center of mass and base of support. Right? If I stand on two legs, I have a wider base of support, and my center of mass is in between that. If I stand on one, there goes my base support, and now my center of mass is deviating, and I can deviate it further with the combined center of mass of me and a dumbbell. My body's going to immediately attempt to self-organize into structure. I'm going to lean in a way so that my center of mass goes right over my midfoot of my stance leg, right? But how is it that I can keep it in function, right? So if I can stand on one leg and hinge, for example, then I can do that with some level of proficiency. It's like, okay, that tells me that the path of least resistance that my body is taking when I'm in a hinge position on both legs is through my function, not through my structure. We see this a lot with people with like SI joint issues. Bodybuilders struggle with like, you know, doing something as simple as like a pendulum row. Like, because the center of mass is purposely deviated anterior to your base of support, if you don't have the trunk stability, if you're stuck in too much extension, I know a lot of bodybuilders that can't do something as simple as a barbell row or pendulum row because it starts to hurt their back. And if you put them on one leg and put them in that position, they don't have a hope or a prayer of actually being able to resist that force internally in their function. In this case, piriformis, glute med, lateral hip structure, or lateral hip function. So it's like, well, if you can't do it on one leg, what chance do you think you have doing it on two legs? Because when you have both legs, now you're closing that circuit into a structurally stable position, that structure being your SI joints, your facet joints of your lower back, the labrum of your femoral acetabular joint. So that's really where I think the model sort of lives and dies. So you have to have the adequate range of motion to get into unstable positions. You have to, when accessible to these unstable structural positions, elicit an effective and scalable stimulus of instability by either deviating center of mass or limiting base support. Then from there, you license those joint positions to express force, which is strength, right? So we want to resist force before we can express force. So a lot of times we put the cart before the horse, and when our strength outruns our stability, that's when we start running into issues.
Can we walk through one of those gradations of stability, like, and how we're moving someone through that for them to kind of understand that we're applying this within the sphere at which we're outputting, and we're not doing this like not only like Bosu ball bullshit, but like what it looks like to actually deviate from center of mass and what those gradations look like within stability training?
Yeah. So like understanding, like I think the lower body is probably the easiest. So going from, I would, for a squat, let's start with a squat. I feel like this is probably the most common plight for most bodybuilders, especially watching bodybuilders squat on Smith machines my whole life makes me want to just eat a bullet. So starting with a stationary, no, it's okay, man. You have the wheels to be indemnified from literally any conversation. When you got legs like you could just basically tell schmucks like me to go fuck myself. But when you think about something like a stationary lunge, like, okay, how does, like, the squat is an expression of function. It is itself functional. Right. So if you can have the base units of function and can prize them together, you can make a really good, long-lasting, sustainable squat. And the problem with bodybuilders and powerlifters and your average gym goers is that there's so many facets to athleticism that can allow you to compensate without, because this is one of the questions that you get met with. Well, I can't stand on one leg, but I can squat 405 in wraps and a tapered belt. Like, that's tremendous. I'm very happy for you. But one of the things is, like, peripheral stability is not the only way we create an internal motion capture of where and how our body moves in space, right? Like, bodybuilders love training in front of mirrors. You take a bodybuilder out off the Smith machine, out of a mirror, put a barbell on his back, and put him in a powerlifting gym staring at a bunch of fat guys with beards. They have no fucking idea how to squat, because they never knew how to squat, because they knew how to fix their squat. And so, I mean, to understand this progression, and without going too far afield into the nervous system, it's like, I need to preface this with, yes, stability is, I think, our most important peripheral input into our cerebellum. So when it comes to athleticism, Tiger Woods has quite an atypical golf swing. But there are other inputs outside of what we consider like the spinocerebellum, which would be stability, deep pressure, light touch, heat, all these inputs that come from our body into our brain. Like your eyes and your inner ear apparatus make up what's called your vestibulocerebellum. And then you have like your motor pattern center in your brain called your cerebrocerebellum. So when we're talking in bodybuilding and gym terms, we're really only talking about inputs that get relayed through the spinocerebellum. The spinocerebellum breaks down into this drop menu of a bunch of different stimuli that have a bunch of different inputs into a bunch of different nerve endings that fire up into the brain. And we have this collective picture that gets made for us from these peripheral inputs through the spinocerebellum. So that's kind of a disclaimer, little bit of an aside, before I go through this unilateral progression and people go, well, I can't do any of that, and blah, 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 405 squat. So I would start off someone with, okay, let's see how it is that you organize your hips and your ilium and your rib cage and your femurs in a stationary lunge. I think we can manage that. Like, let me see. And every bodybuilder is going to do the same thing. They're going to overextend. They're going to externally rotate the extended hip. And they're going to have, because what are they trying to do? Well, they're trying to create a broad base of support, right? Like, they're not going to want to go into the functional distribution or the functional relationship of extension and internal rotation of that back hip. They're like a blind guy with a white cane. They're just trying to map their environment because they have no internal stability. So they're trying to use other inputs outside of their proprioception in order to create this, polished image to come up into the cerebellum with the other two inputs, vestibulo and cerebro. So if I look at that, I go, well, you don't have enough hip extension and internal rotation. How can you expect to squat if you don't have enough internal rotation in your hip, right? So that right there, it's like, well, I'm not going to squat you because I know that we don't have the functional stability or capacity to do that, and you're going to be loading into your structure. You're going to be grinding the shit out of your SI. out of your femoral acetabular joint, right? Like, I mean, I hate to pick on him, but like Roman Fritz just had a hip replacement. Roman's an animal guy. He's been part of animal for however many years, but you know, the guy just did a bunch of crazy ass squats forever. And I don't want to pick on him because there's a bunch of guys out there, but it's like, if we paid attention to these precursors, we paid attention to these performance indicators, we could stop this inevitable dysfunction from manifesting itself. Because that's look, you're loading into structure. You're not loading into function. You're getting the stability from the bones, from the labrum of the hip, from the SI joint, from the intervertebral disc. You're not getting it from your adductor stabilizing your pelvis, your glute med stabilizing your lateral hip, your core stabilizing your pelvis. So stationary lunge would be where I'd start. Can you stationary lunge and get something that resembles, you know, hip and knee flexion? Go from there into walking lunge. Can you now perturbate this scenario and introduce a deviation of center of mass and base of support? Right. So now we're going through stance phase and swing phase. Now we're actually testing the lateral stability while we're in stance phase, which is roughly like 55, 60% of the entire gait cycle. So it's like you need to start to calibrate for your sort of dynamic stability before we start standing still and calling on our structural stability. We need to know that we're firing on all cylinders. So basically stationary lunge, walking lunge. You could throw in something like a Bulgarian split squat or a sprinter's pose, something that allows you to go through terminal knee extension and organize your ankle, knee, and pelvis in a straight line. Then it would be getting into hinge patterns like single leg RDL, and then ultimately hip airplane, depending on your squat depth. So every single one of those progressions is adding either a limitation of base support and or a deviation of center of mass. So that would be, and then from there, you would just pair your squat patterns accordingly, right? So if someone can't stationary lunge, it's like, or if someone's at stationary lunge, like, all right, let's try walking, and they start falling all over the place. Like, okay, we're gonna do like a counterbalance squat to start. Because it's gonna be self-limiting in the amount of load. We're gonna better help organize the rib cage and the pelvis, just given the constraints of the loading parameter of the exercise. We're gonna keep you more structurally stable in the way you squat, keeping your rib cage over your pelvis with the weight out in front of you, because you haven't earned the right functionally to be able to resist that force. Walking lunge gets better. All right, let's move the weight in a little bit. Let's try and sit into those hips. Now we know the hips are a little bit more stable. So we go from counterbalance to goblet to front to high to low and so on, right? So that's kind of how those two progressions will sort of superimpose over one another. And that model, again, just because someone, like I know plenty of guys who break world records. Like I'm sure Vlad Alzahov can't fucking stand on one leg. Vlad Alzahov can't see his feet, but he also squats like 1,100 pounds. So does it matter? Not really. But if Vlad Alzahov like jumped out of his truck, he's probably more likely to herniate a disc in his back or some shit like that, because he doesn't have the functional capacity. He has a large deviation of his center of mass because he's a big dude, but like athleticism is more than just a peripheral spinocerebellar input. And that's like to double back to the disclaimer from the beginning. It's like we can fill the holes and we can bridge the gaps in our mapping issues with the other two inputs that make up and comprise the cerebellum. And that's like our eyes, our inner ear, our balance points, and our cerebral cortex. But if we're talking purely about the neural sharpening of the spinocerebellar inputs, stability does become the most important because it gets transmitted the quickest through the body. So if we look at something like slow pain, that's a part of the spinocerebellar tract, that gets relayed at like a pain in general goes 3 to 30 meters per second. Proprioception, that gets transmitted through these things called A alpha fibers, and that goes 120 meters per second. So there's an evolutionary reason that proprioception is the quickest thing to get to our brain. Our body wants to know where we are at all times, and that's that internal motion capture. So when dealing with maybe like less athletic populations and people who are just worried about the gym, it's like, can we try to have a modicum of athleticism involved in your training at all? Or do you want to just go do your 405 Smith machine squats in the mirror and totally dumb and deaf and mute your peripheral inputs?
Yeah, I think there's some good points to definitely bring out of that, because you have this conversation where people are going to listen to this and definitely say like, well, I have my 405 squat, I must be functionally perfect and stable, right? And I've been in there, like with especially my pressing movements, like and I powerlifted, I've set some big numbers pressing, and even still like, but why is this important to everyone else? Is because like, well, for me, like, hey, you start getting like niggles and injuries and connective tissue damage occurring. It's like, well, why is that happening? Oh, maybe I'm just bench pressing too much. I have to lay off. And then you start working around injuries. and you start bringing in new movements. But why did this happen even to begin with? And so like some of the guys that I've worked with in rehab and doing like functional movement systems and people that are familiar with these other programs, you know, you become like, and you find these weaknesses within muscles, right? And so it's, oh, well, your serratus is weak, your rotator cuff's weak, et cetera, et cetera. Your structures are compensating, muscles are compensating. So you can have the perfect bench press still. You don't know any different, but you're overloading these other tissues. But just the root issue here is that you gave me, he gave me a kettlebell to hold in one arm in a bench press position. And I was fucking shaking and quivering. And it's like, holy shit, like I have a 15-pound kettlebell. I can't control the damn thing. But if you put 300, 400 pounds in my hands in a bench press, hell yeah, I could smash on that. And so it's like, well, what the hell's going on here? If I can do that, it's like, yeah, because you lack the stability and the supporting musculature around it. So what is going to lead into that is at some point down the road, you're going to get injured. It's setting yourself up for that. So even if you have like this perfect squat now or perfect bench press now, it's like, hey, I don't have these problems that Jordan's talking about. You might actually still do, and you're just leading down the road to this issue. Or even then, you're not getting the most out of your current training, right? And that's even a potential as well. So with that being said, like say this you know, world record powerlifter that has this phenomenal squat that also has this instability issue, put on one leg, he falls down, or you know, goes to pick up a box on one leg and you know, tears a hamstring off, or something happens like this. Usually we're getting injured outside of the gym. Why? Because we're not, you know, stable within a lot of these movements you're talking about. What do you see? Because I want to say like people to investigate, like, hey, you're going to get a benefit out of this. What have you seen change-wise with addressing stability in people that say like, hey, I don't need you, Jordan. I don't need all this stability training.
Yeah, and that's fine. I mean, it's people's own prerogative. But look, some people are too weak to get hurt. Like, let's just throw that
Fair
out there.
enough.
Like, some people are too weak of mind. Like, it takes a lot. Like, I've torn some muscles, and it's like your body's like, yo, and you're like, shut the fuck up. We're doing this. Like, YOLO, ride or die. It's like, and some people, and it's always the 405 and wraps guy who's like, yeah, you fucking nerd. It's like, all right, man, whatever. Then don't do it. I don't give a shit. I'm 405 forever. Like, I don't have the time for this. What I would say is one thing that I think is pretty eye-opening is kind of what you alluded to, and that's something that we call a biphasic response, right? So a biphasic response is like, if you can think of like conventionally how like vaccines work, where, and like I don't want to get into any nonsense about that shit, but like polio is not a thing anymore. I'm just saying. But if you think about like a vaccine, like an attenuated version of a virus, your body's performance after getting a vaccine administered is probably going to go down because your immune system, like, yeah, the fuck's going on here? Like, let's deal with this nonsense. But so this is like biphasic, so 2 by 1, 2, and then phases, like phasic phases. The first phase of like post like inoculation is like, well, your body's like immune system performance is going to kind of go down because it's got to deal with this new thing. You're like, oh, fuck, okay. And then it's gonna be like, all right, we kind of got it under control. Then what happens? The second phase is we've gone from baseline, went down, and then we've reached some sort of lull or valley of function. And then all of a sudden your body goes, okay, like we use the immunoglobulin system, and then we get IgEs and IgM and mast cells, histamines, and all this shit, eosinophils, and then we're like, oh, okay, we're good. So if we see this fucking thing again, we're sweet. That's kind of what happens when we introduce instability and mobility training specific to, you know, people's deficiencies in particular ranges of motion, and then the subsequent instabilities that follow. It's like, I'm going to give many a guy who benches 400 pounds a 15-pound kettlebell and be like, hey, I want you to, like, you know, do what mobility crap you got to do to get the overhead position before you train. Put a kettlebell over your head, unstable load, unstable position. Give me 10, 12 reps. Maybe do some, I don't know, some serratus drills, some T-spine rotation stuff, and then go bench. What often happens is people do that, and then like, oh man, I only got 315 for 6. I usually get 315 for 10. Like, you're telling me that a 15-pound kettlebell took like 4 reps off your 315? It's like, that's a huge, like, I thought it was nothing, man. Like, I thought it was just like, this was some pussy shit. It's like, but 15 pounds took fucking 40 pounds off your bench press. And that's the initial part of the biphasic response. Like, do you guys have dogs?
Yes.
Yeah. Right. So I have a German Shepherd, and the only way I can take Axel to the park and I can throw that tennis ball until my arm falls off. Never tired. I'll die before that dog gets tired. But if I like start hiding food around the house and like making him think and like do a bunch of drills with him, then he gets tired. This peripheral athleticism that we're trying to evoke, this modicum of athleticism, this reactivity, the sharpening of like this peripheral spinocerebellar pathway, this makes you actually think. Like this makes you act and react, right? And then that process, if that's making you tired and it's taking 40 pounds, well, it's like, look, just do this for a few weeks until the 15-pound kettlebell moves up to like a 20-pound kettlebell, and the 6 reps on the kettlebell bottom under press goes to like a 10 reps or whatever. Then all of a sudden we're going to reach the ascension on this biphasic response. And in this ascension, we're going to make the adaptations, and we're no longer going to be taxed. So we can kind of do this. We can do this not mindlessly. That's a wrong way to look at it, but we can do this a little bit more autonomically. We can do this without having to act and react as much. So we have that stability pathway sort of sharpened. And then in such, we start to go, oh, now I'm back to 315 for 10, and now I'm doing 315 for 12. And 315 for 15 and 315 for 20, because it's like a lot of times the reasons people aren't ascending in their weights is not because they can't exert more force, but it's rather their ability to exert force is predicated on their lack of ability to resist force, right? So a bench press is always a tricky one because you can hide your internal instability with your external stability of the bench, right? People move over to like a Thompson fat pad and all of a sudden like, yeah, fuck yeah, man, extra 10 pounds. It's like, that wasn't you. You just had this, this perception, right? This perception of increased external stability. It's like, why don't you just do that in your own body, right? And so that's often what you should anticipate. And some people, if the adaptations, and a lot of times this is something true of like athletes that get into the sport of powerlifting. I'm going to call on powerlifting as it's kind of my forte. The best powerlifters on the planet are some of the best athletes on the planet prior to getting into powerlifting. Right? Dan Green used to be a male cheerleader at the University of Michigan. Kevin Oak, sprinter at Villanova. Steffi Cohen, like a world champion in 3 other sports, and watch her get into boxing now. Like, because they have this athleticism that when they can sharpen the peripheral spinocerebellar, they have the other 2 components really sharp. Where some Joe Jackass in the 405 in the Smith machine doesn't have that athleticism, we're likely going to see a slower refractory period on that biphasic response in someone who doesn't have an athletic background. Then when you have someone with an athletic background, I've seen this put 10-pound, 15-pound PRs on the bench in a single session. Because the skill of adaptation in itself becomes a skill. Not even the end result, just being able to turn over and learn new skills, that in itself becomes one of your greatest resources as an athlete. So athletes, I tend to find, take to this in almost an immediate fashion, and the perception of joint stability increases in the session itself, and we see an expression of strength off the tail out of that. On athletic populations, we see this biphasic response spread out over weeks or months of training, but inevitably once those adaptations are made, albeit seemingly minor to us and them, we're going to start to see an ascension in that biphasic response.
Yeah, and so for the population we're speaking with, like on the podcast, is predominantly bodybuilders and not just your average Joe and average housewife or something, but and so that drop off period could still be there for people. I noticed some slightly, and probably because I, like most of us type A, go hard on everything. And so we'll all fucking go hard on this rehab kettlebell hold. And then I'm super fatigued going into training. So there's probably is a appropriate rate of progression. And for someone that's still like, hey, say you're at the professional level, you need to still have productive training. And so you don't want this huge drop offs. Potentially, would that be something like, hey, your kettlebell holds, maybe you should do them on days you're not doing your upper body sessions. Or it should be on days that you're doing your body sessions, and what should that frequency and duration maybe look like going into these prehab or activation or whatever you want to call it before going into training? And does that lead you to any like increased susceptibility of risk because you fatigue these other muscles that aren't used to having the stability, and then you're going to go again and go perform, say, a squat or a bench press, and now you're not able to perform as high? Or would you lack stability then because you fatigued these other areas?
Right. So there's a few parts to that question. I'll start with like the integrating around the exercise itself. So I think you should always be doing this prior to your exercise that demands the greatest amount of internal stability, which is likely going to be one of the first couple exercises, if not the first exercise in your session. Like your capacity to internally stabilize is going to go down as a session increases.
Mhm.
Like having a squat as a finisher is not likely the best way to drive the greatest amount of output from that squat. Right? So squat is for a lot of people a skill that you practice. If you want to hop on a leg press at the end of the session and just fucking go find God, by all means, you have my blessing, right? Because it's externally stabilized. So like organizing your exercises in a way where we start least externally stabilized and then transition as the session goes on into more externally stabilized, thus diminishing the demand on that internal stability. But I think one of the things that gets missed in organizing a warm-up is the actual integration of the warm-up into the objective outcome of the first exercise. So if the warm-up has some component of mobility, some component of stability, I want to see that warm-up be integrated into the actual first movement. So let's go with like the squat, for example. And so maybe you come in, you try and transiently improve range of motion through all three planes of movement of the hip. Maybe it's a couch stretch, maybe it's a frog stretch, maybe it's something like a pigeon. So you kind of get internal rotation, hip extension, external rotation, abduction. So you sort of gain the requisite range of motion. And not that hip mobility oftentimes is, so when we work on mobility drills, it's merely to get the body inoculated to the position we would need to then load instability into. So if we're thinking like a single leg hinge or hip airplane is something where it might be our furthest afield progression of instability, it's like most people don't necessarily need to stretch to get into those positions. If you do, then you can go down that whether it's self-myofascial release, whether it's static stretching. I don't necessarily care. I think a lot of times context gets lost in the conversation around stretching prior to working out, and we go to the research and like, well, research says you're going to tear a hamstring and be weak. It's like, yeah, but the research was also like hold the fucking hamstring stretch for 90 seconds and then do a max vertical jump. It's like if I wanted to write the equation on how to have a shitty vertical jump and to tear a hamstring, I would just get people to do that. Right. So it's principles, not evidence. So I think in this case, it's like, yeah, if you need transient inhibition to get into these positions of instability, then do that. Right. So like, let's say we go through some bouts of static stretching in our first circuit, and then we go into some, maybe it's self-myofascial release with like a dynamic component to it. Then we go into, maybe like a single leg hinge or single leg RDL. After the single leg RDL, put a bar on your back. Do an empty bar, because it's like we're changing the hardware of a circuit board, and we want to see if we're exacting the change that we're looking for. Or it's like, maybe let's make this a little bit more analog. We have Christmas lights that our parents bought 40 years ago that if a single bulb is out and they're run in series, that bulb is not going to, the whole strip's going to go down. So it's like the warm-up is changing all the bulbs. And then a lot of times people like, they don't plug it in after. Like, well, fuck, they just like shit where, look, unless your workout is 15 minutes or 50 minutes on a fucking spin bike, your warm-up should not be 15 minutes on a spin bike. We're going to get some blood moving. It's like, oh, we look at that. I have a pulse. Okay, my blood is moving. Now what? Right? It has to be specific to the task at hand. So like, what range of motion do you need to get into unstable positions to improve the joint stability of the joints we're going to be loading in the first exercise? So get your range of motion, stabilize, then integrate. Think of it like a 4x100 relay, where it's like the second guy isn't standing still when the baton gets passed. He's moving. And that's how we should integrate our warm-up into our workout. It's like, okay, I go through some bouts of static stretching my first circuit, maybe some like dynamic self-myofascial release. I go stand on one leg or do hip airplanes, depending on what exercise I'm doing. Then I go squat, and then I go back again. So after I squat the NP bar 20 times, I go back and maybe I do static stretching, maybe I don't. Maybe I let the static stretching fall away. Maybe I just go back and do some stability drills, and then I put, I don't know, quarters on a side. And then I do like 10 reps at 95 pounds. And then I go back and do some more stability drills. And then I go back and I go like 135 and like, okay, good. So the warm up has ceased, and now the workout has commenced. So I think that's one of the biggest things in organizing these things, as far as like, how does this actually work in my program? And I don't like, because this is a novel stimulus, and be novel in the sense that when people do it, it's going to be new to them. Like novel and specific are kind of like, I don't know, it's specific to the rotator cuff, but it's novel as it's new to the, or in this case, the lateral hip, but it's novel in the sense that it's new to the person doing it. I don't think at the shoulder and hip, you necessarily have to be concerned with the accumulation of fatigue, because your body is going to auto-regulate your output based off of that. Now, the spine is going to be a little bit different because of the way that the deep spine musculature is innervated. So I'm not a huge proponent of pre-exhausting the core prior to axial loading. So I wouldn't recommend anyone doing any sort of substantial core work prior to squatting, because there's a different neurological pathway that innervates the deep spinal musculature that's autonomic and not voluntary. So whenever we're doing the lateral hip or adductor, secondary pelvic stabilizers, rotator cuff serratus, that's voluntary muscle action or function, whereas deep spine is like is involuntary, it's autonomic. So that's one thing I advise against, is monitoring your core work specific to when it is you're going to be axially loading. And it's not so much when I say core, I don't mean the ramifications on like the rectus, the transverse, the internal and the external oblique. I mean more so, what are the underlying implications that this core work might have at the erectors, the multifidus, the rotatories, the transversospinalis group on the whole. So that's where I start to shy away from. And like the idea of core activation prior to training, to me, it's just the dumbest thing in the world. Like if you squat 300 kilos and you're doing a dead bug before you fucking squat 300 kilos, you either shouldn't be squatting 300 kilos or you shouldn't be doing a fucking dead bug. So hip and spine, or shoulder and spine play by a little bit of a different rule book hip and shoulder play by a different rule book than the spine. So I'm not a huge advocate for the pre-exhausted spinal stability prior to training. But I am a fan of the idea of getting that pathway sharp through the shoulder and the hip, because that pathway runs through a different track than the deep spine.
And Jordan, correct me if I'm wrong, but like a way for the viewer or listeners to kind of conceptualize this, it's almost like a test retest system where like it might not be the exact same movements that we're choosing to train within the warm up in the exact order according to what this test retest system tells us is going wrong within this process of like stability pattern, first warm up, second pattern that we choose. This test retest system is in order to integrate the right patterns in which we need to do between our squat warm ups, correct?
Right. Yeah. So we're not mobilizing for the sake of the exercise. We're mobilizing for the sake of the unstable position of the joint in which the exercise is based on. Like nothing, like an air squat to me is just silly. What are you doing? Just put it at the end and put a bar on your back. Why are you doing air squats? Like you want to, like say you lack internal rotation of the hip, right? A 90-90 position looks nothing like a squat, although a 90-90 can evoke a good amount of passive internal rotation of the hip, which then when you stand up and go in an airplane and create rotation on a fixed femur, you can then access greater ranges into that 90-90 or that internal rotated femoral position, which will then carry into the squat as you load it. So it's like, that's the prerequisite system of mobility and stability and strength, is like, you're just trying to gain range of motion to better improve your position in which you train that joint's functional instability at, and then integrate that into the actual exercise itself. So a lot of people get very exercise focused and they're like, well, I got to mobilize my squat, so I'm going to squat. Like, yeah, look, again, like, that's fine. That's a low resolution model. And like at the end of the day, if you don't want to do any of this, like that's totally cool. But to me, in the way like the arthrokinematics, so the joint mechanics transpose over into the biomechanics, that's how that's a frame shift that people kind of sometimes struggle with, that their mobility work has to be tailored to the position or the desired joint position to train functional instability rather than the actual exercise that comes a few steps down the line.
No, that makes complete sense. And it's usually like, what do you need in the exercise that you're going into, like your squat, you need external, internal rotation. So that can help kind of guide what mobility pattern you should start with. And then from there, move into these functional movements that test that stability and challenge it, cause adaptations. Then you can move to your squat from there. I think that builds an approach of someone. Now this is, these guys that are looking into doing something like this, of course, well, hey, you go through Prescript, right? You go find Jordan. But you did bring up one thing that I wanted to pick out is the utility of like myofascial release. Like people ask me all the time, like foam rolling, like should I even be doing this integrating my warm up? Is there more of a specific application for it, and maybe areas that you don't do it on? It's like, hey, my hamstrings feel tight. Let me go roll them out. Oh, great, they're loose now. Now I'll go train. It's like, well, why were they tight to begin with? Like, should we be foam rolling to make them loose? And so I want to just like pull that out and see what you had to say on as far as implementing foam rolling.
Right. Yeah, so I take a different stance than like most academics. Like most academics will be like, foam rolling stupid, blah, blah, blah. It's like, I think you're stupid. How about that? And you're stupid and you're weak. Because it's just, again, people don't take the time to map the central nervous system. So we have like these different, so we talk about proprioception as sort of like the synonymous term with stability, right? So proprioception gets relayed by these things called your muscle spindles. Muscle spindles, they kind of like wrap around intrafusal muscle fibers, and then as those muscles stretch, we go into more structurally unstable positions, it elicits this feedback loop, which causes intra and extrafusal muscle fibers to start to contract to calibrate for that joint position. So proprioception muscle spindle, that's one nerve ending that comprises the spinocerebellar tract, which we talked about earlier. But in that spinocerebellar tract, where yes, proprioception and muscle spindles get relayed through the spinocerebellar tract the quickest, which is probably trying to tell us something, that stability and your body's ability to map its internal environment is pretty damn important. But there's also things like Pacinian corpuscles and Ruffini endings and Merkel's disc and Meissner's corpuscles, and all of these other things can better help us understand why it is that these things work. Why is it that foam rollers are so popular? Why is it that Theraguns are so popular? Well, Meissner's disc, Ruffini endings, Merkel's disc, Pacinian corpuscles, all these other nerve endings that fall in a similar category, like a muscle spindle or Golgi tendon organ. All of these that comprise that spinocerebellar pathway. Each one of these is kind of responsible for being a lock to a different key, right? So like the key of using vibration, right? Vibration triggers this nerve ending, and then it causes an inhibitory reflex as a consequence of that. Now, it doesn't move as fast as proprioception does, but it's part of the spinocerebellar picture on the whole, right? So we can begin to justify why it is that Theraguns and Hypervolts and your fucking DeWalt with a wine cork on it, why are these working, right? Like, why is it that every NFL team has a fucking whole lineup of these things just ready to go? It's not that they're not working, right? Why is it that people, like I mentioned Donnie earlier, like how is it that Donnie Thompson is selling people hunks of fucking steel? Why is that a thing, right? And it's like, well, it's just deep pressure stimulus. It's different than vibration, right? Some people go like skin stretch. That's another one. How is it that voodoo floss bands work? Because you have fucking joint receptors in your skin, like in layers of your dermis, that trigger that input in helping to create this peripheral mapping system within your body. So all it just tells me is this is information, right? This is information that we don't have a complete map of our body. So yeah, deep pressure, foam roll, vibration. You want to put your fucking exhaust or whatever the fuck Donnie's selling people on your legs? Yeah, go ahead, do it. But it's just telling you that there's an incomplete picture. And maybe that incomplete picture exists outside of the realm of the spinocerebellar tract, right? And we see this with people who are just gym rats who don't have an athletic background. Is like, they don't know how to integrate acuity and rhythm into their training. They can't catch a beach ball. Like, there's no coordination because they just work through the sagittal plane on these fixed tracks with their knee wraps and their headphones and their fucking elbow sleeves and all this shit. Right. So that's why, like, it's not really fair to look at things and demonize things like foam rollers and all that. I think in the case of tightness leads or is stemmed from your body's unwantingness or unwillingness or uncertainty to advance into positions of further structural instability because it doesn't know how functionally we're going to respond. Hamstring, classic example, right? Hamstring tightness is basically your body saying, hey, we don't want your pelvis to move anywhere that resides outside of its stacked position on the rib cage, and we don't want your femurs to move anywhere that's not underneath the pelvis directly. Why? Because that keeps us in a structurally stable position, because we're not certain that when we reach the outer borders of our structural instability, that our function is really there to take the role, right? So when we look at the role of the position of the pelvis, being directly stabilized primarily through the core and secondarily through the adductor group, it's like the hamstrings just stop you from moving into positions where we're going to test the functional capacity of the adductors and or core. So it's like if you stabilize your pelvis and teach it to be stable in these structurally unstable positions, your body will allow you to move in and out of these positions. Until which point, we're just going to govern that range of motion by tightening the shit out of your hamstring. So we can't move our pelvis into this position, which will put an inherent demand on some of the muscles that are meant to primarily functionally stabilize the pelvis, if that makes sense.
It does. So could you say if someone does have reoccurrent, the perception of tightness in these muscles is that should be red flags that you are lacking stability in these other muscle groups and structures that need to be addressed?
Yeah, without a doubt, man. Like in the hip, basically, like the shoulder, hip, and spine have different rule books. The required range of motion at the shoulder, or the desired range of motion at the shoulder to train functional instability, is flexion and external rotation of the glenohumeral joint in a neutral rib cage. And the desired range of motion at the hip is extension and internal rotation with a neutral pelvis. If you can do that, if you have mobility into those ranges of motion, you then have the range of motion necessary to start to elicit instability where needed, right? So like extension, internal rotation, that's going to cause your psoas to start to primarily stabilize your lumbar spine. That's going to cause your TFL and your glute med to start to laterally stabilize the hip, flexion, external rotation. That's going to be a pretty good position for your teres minor and your infraspinatus, and also a really good position to start to train your serratus anterior, right? So, these joints are kind of, you have to be able to get them in the right positions for these kind of, I don't want to say second order, but for these muscles to be able to function properly.
Yeah, I just wanted to bring that up because that's always something that everyone can relate to. You speak pretty high level on, a lot of these different functions, but for someone to just like simply relate that doesn't understand at that high level, this like a tightness is like, could be like a red flag, but going from like the myofascial release and tightness, people use lots of different types of tools, right, to address this as well, as far as like chiropractor work, massage work, all these different other systems, compression therapy. I mean, you name it, to like for recovery, or like what is the things that we should be putting weight into for a rehab individual that wants something like like a massage? Like, does massage have any, someone just poking on you, the cupping, all this stuff? Like where's the value? Where is not the value?
Yeah, it depends, right? Like it depends on if they're turning over the big rocks first, right? Like a lot of people just fucking lazy, right? Like a lot of people, that's it. Like people just fucking lazy. They're lazy and they don't actually want to get strong. So it's like, yeah, go ahead, get your massage and go to your chiro once a week and just keep being lazy. But it's like the real answer is going to be something, because look, I've been in practice for 6 years. My job is to have an effect on other people's nervous systems. I know that. Now, when it comes to chiropractors, I don't know if there's many chiropractors that could have have the potential to have an effect on other people's nervous systems as much as me. I can bring a pretty heavy hand into an office if I need to, but as heavy-handed as I can be, and not to say heavy-handedness is the only way to affect a nervous system, but if you're trying to elicit some sort of response on a guy's upper trap that's used to having 900 pounds on it, it's like, you better be able to bring the fucking house, right? But as much as a potential as I have in manipulating the perception of someone else's nervous system, no matter who the person is, they always have a greater potential to do that than me, right? So I just need to get them in a position for them to be able to make that change internally. Because so rehab exists on a spectrum, right? When it comes to range of motion, it's like passive, active assisted, active, and active resisted. So chiropractic, physical therapy, massage, as far from an efficacy standpoint, in the way that these practices or these subdisciplines of manual therapy are commonly practiced, they exist almost solely in the passive range of motion, right? Maybe active assisted, but it's like the big rocks are active and active resisted, right? And this is where, like, I think a lot, and I'm a chiropractor that practices, I see 12 people a year. They're the same 12 people, and I see them for weeks on end. And they're on the table for like 5 minutes, and then they're in the gym for, 12 hours a week. Right. So it's like, how is it that a chiropractor or a physical therapist can take the ideas behind corrective exercise and turn it into just exercising correctly? Right? Like, you should be able to look at a program and be like, okay, we have big holes in where we're attempting to expose the function of the shoulder, hips, and spine. but I don't want you to put in the red TheraBand external rotation exercise. I want you to be doing, pull-ups with a pronated grip, and I want you to integrate pullovers with a neutral grip with supported D handles at shoulder width. Like that's where you start to bridge the gap. And frankly, like, look, and for some people, chiropractic, physical therapy, massage, at least it enters into the spectrum of stimulus. And so I worked as a corporate chiropractor at Apple when I first graduated. These people don't lift weights. So I was simultaneously working at Boss Barbell Club with Dan and the other powerlifters. And then on the flip side of the spectrum, there was just software engineers that were just coding your next iPhone. But you would get some pretty amazing results in cracking someone's back that sat there for, because that's literally the only motion they're going to get into their spine at all. So it's like, it's not to say that, obviously I don't think my profession is useless by any stretch of the imagination, but if you're someone who's pushing performance, whoever is practicing they better be able to bridge that gap from passive even into active assisted, past active assisted into active and active resisted, right? Like the rehab for you guys, your rehab could involve 225 front squats if you had like a low back injury, right? Like, hey, let's minimize shear force. Let's elevate your heels. Let's keep your rib cage stacked. And for you, a 225 front squat's going to be nothing, right? Where I'm not going to have you we're going to do Peterson step ups and terminal knee extensions with a band around your knee. It's like, you fucking joking? We have 40-inch quads. What the fuck is that going to do? Right. So understanding, like, I think for people listening to this, it's like, if your clinician isn't having the conversation around how to scale from corrective exercise to exercising correctly, just don't go. I mean, I don't give a fuck. Like, if it feels good, whatever, you want to waste your money, that's your prerogative. But like, as far as efficacy goes, like, you have to understand that the corrections being made at the level of the nervous system and the limitations of passive range of motion and external stimulus to affect, like, an internal stimulus is always greater than an external stimulus. You don't put a TENS unit on your arms pre-Olympia to grow your arms, because that's just an external means in which causing a muscle contraction and sarcoplasmic depolarization, all that bullshit, right? But the end result is the same. People miss that when they go into manual therapy. It's like, no, the internal stimulus is always going to be stronger and better adapted than the external. So you need to put yourself in a position to actually load the internal stimulus to make the adaptation.
Yeah, I think it's just like an education ignorance area. And I've been there too. It's like, you go to massage therapy and you're like, well, whatever they're doing, however they're moving their hands across these tissues, that's what it needs to be done to make that healing process happen, and praise the Lord, right? And usually anything where someone is trying to put a stimulus onto you is, like you said, it's never going to be as effective as giving that stimulus yourself. And the most like profound and greatest rehab that I've done, and when I had all these issues that occurred, was getting me off a table, because it's great to, on an off day, go lay somewhere and have someone just poke on you, and you're like, hey, I feel pretty good afterwards. But then I went to a guy that actually, like, hey, we're going to get off this table, and it's almost like turning into a training session. I'm like, this fucking sucks. Like, this is like, now it's work. But that work was the fastest thing that could get me back and going again. So, I think like you said, if you have someone, it's really a totally integrated approach. Like, they can't just have like chiropractic work. They need a multi-system approach and understand exercise to get you off a table and get you back into moving into those positions you want to move in. And I think that's when you're going to see whether you're making profound change. And if you have someone that's around you, that's good application of what they do. So like, what if someone's like, okay, I'm trying to find someone in my area that has this knowledge set to apply. It's like, where do I even start? Because I get this question a lot too. Like, who should I go to, John? And then I'm like looking up online different credentials, and that's a tough question. What do you refer people to? Like, hey, these are the XYZ things that this person should have. If you need someone to help assess your movement dysfunction, your injuries, or whatever's going on.
Yeah, I mean, I'm lucky now that I've been able to establish like a pretty broad network of coaches that have gone through like our program. So I usually start internally with prescript coaches, and then from there it's definitely tough, right?
Hey, Jordan, so real quick. So on prescript, if they go on, you have a list of all your coaches on there?
the new iteration of the website should be up in the next week or so, and our directory is going to be on there.
Okay, perfect.
But the hard part with like moving outside of that, and I put the onus a lot, and increasingly more so, on the lifter itself. Like, I know the majority of lifters that come to me with this stuff, they know more about their iPhones and the Instagram algorithm than they do their own body. And it's like, that's a choice you made, man. Like, the resources are out there. So for me, I don't say I lose patience, but I don't like excuses. So it's like, if you're coming to me and asking me if like this guy's good and you don't know your ear hole from your asshole, and this is going to be something that you're supposedly passionate about, and or it's a way that you secure your own income, maybe start taking this fucking seriously. And so I think it's on, especially as we start to deal with people. Look, if you're a mother of 5 and you work at a job and you got bills and shit, yeah, fuck you don't have time to. But if you're just some schmuck like us that work on the internet and like coach people, it's like, dude, read a fucking book, man. Like, so I think a lot of people who are stifled and potentially disgruntled with the process of finding a good clinician, and they just sit there and they throw their hands in the air like, it's like,
It's
how
lazy,
about you better?
right?
It's 100% fucking lazy, and it's the same guy that leans for the Theragun. It's the same guy that doesn't listen to what he's told anyway. So it's tough. Like, obviously you don't want to leave anyone high and dry, but like, you lead a fucking horse to water, man. But at the end of the day, it's like, I'm definitely more now, like, just how available good information is, I think. And discernment is a difficult quality to have, especially in something you don't know, but like, learn it. If this is how you make your money, like, how many people who are like online coaches, and maybe they got a few coaches underneath them, and they're making good money. Like, oh man, like, there's no good chiros out there. It's like, just fix your own. Like, dude, a library card costs like a fucking $1.50. Like, just go figure it out yourself, because you have internet. Read. So yeah, I think it's just lazy. And again, that's a pretty. Like, I've been around this for a while, and I get the question posed to me a lot. And again, I'm lucky in the sense that I have like a broad network, sort of now, like across, I don't know, 49, 52 countries or something like that. So I can have a database in which I can draw from. But a lot of times, even if I'm sending someone my way, I don't want to send my coaches some pain in the ass lazy guy. So I'm like, look, what's an olecranon process? What? Maybe you should just go to the local chiropractor down the street. So I think it's, the onus is on the individual at the end of the day.
Yeah, I agree. And I understand, like, I feel for people, like, if you are, time spent in,
Absolutely.
and hey, I don't have time to sit and learn, an hour-long lecture every single day and eventually address this issue. But that's not asking all that. There's little aspects that you can do to learn along the way. There's plenty of courses to slowly pick things up over time. And then maybe you have someone out there that, hey, you listen to Dr. Jordan Shallow and he's giving you some tidbits, and you can start investing in those individuals that are putting out, the information.
It's all, man, people spend more time researching the fucking diners they go to in towns they've never been in than going, like, what are you doing? It's like, this Denny's got like a 4.5-star review. I don't know. Want to get a grand slam? It's like, yeah, come on now.
Yeah, I'll watch an hour of TV like every single day, right? Pretty much. That's my like wind down time. We chill on the couch, watch it. Like, if I really had some other issue, like, I would pull that time out and put it into what I needed to. But I completely agree. Like, nowadays you can figure out how to do anything. Like, I'm not like, I just installed overhead lighting in my garage. Like, I fucking went in the attic. I hardwired the wiring. Like, I'm not an electrician. I was at risk of death, but you can do these things, and just like, you can learn your body and learn some like basic prehab and how to assess yourself. Like, that is a doable thing because so much information is there. But like you said, like, discerning through the information can be kind of an issue because there's so much out there that are present. But that's when you do look for someone that has credentialized to present that education material. So what are like your like final thoughts, Jordan, on mistakes that you made within addressing injury profiles, assessing strategies, managing that for a physique athlete across like the long term?
So you're asking kind of what are the common mistakes we see in physique athletes as far as like sustainability in their program?
Yeah.
Yeah, I kind of alluded to it earlier, man. I think it's like the initial compromise, right? Oh, this hurts, so I'm going to do this on a machine, or this hurts, it hurts when I do this, so I'm going to move my grip out a little wider. And like they just put themselves in such a smaller and smaller box until all of a sudden they have, potentially irreparable damage. So I think, heeding to those warning signs and using those as an opportunity to begin to learn the underlying issue of the day. Because over time, like, I don't know, man, I went to chiropractic college I graduated with 45 other kids in my class. The stuff I talk about is not from chiropractic college. Like, I had half of my graduating class take at some point one of my courses. So it's like, I tore my quad on a triple of 300 kilos. I tore my pec benching before the pro raw at 200 kilos. I played 20 years up to like the semi-pro level of hockey. I was riding my bike to the gym once, and this chick who couldn't see over the steering wheel of her dad's Suburban T-boned me on my 10 speed. So I like totally Mel Gibson my left shoulder. And each one of those was like and I learned more in each one of those experiences because I was like, look, this is a problem. I'm going to prioritize this above all else. So I was in chiro school and I got my left shoulder separated. And by the time I was, 6 months post injury, no surgery, I could have taught a graduate school level lecture on shoulder separation. Right. And I didn't learn that from Dr. Feinberg. I learned that from, Suhan Liu, the chick who couldn't see over the fucking wheel of her dad's Suburban as she sailed through the stop sign, right? So it's just, I think people don't see the opportunity in some of these things. Like, I tore my pec, and 2 years after tearing my pec, I remember it was in early August, I got a call from a guy who was the next day about to play Roger Federer in the US Open, and he had torn his pec. And he was like, he reached out through his network and was like, I need someone who knows this, and I need to know like what I'm like, do I play Roger Federer tomorrow or not? So I had a call with this Australian tennis player. I basically had to walk him through because I had I went to school and all that shit, but he was not calling me because I went to school for fucking 9 years. He was calling me because I tore my pec, because I was willing to lay out for it and actually do the damn thing just as he was. Right. So like, tennis, we can look at tennis and be like, oh, it's kind of, well, whatever, but tennis is a pretty badass sport. So like, I think that's the biggest thing with people in their own development is like, my elbow hurts when I do triceps up here, but it doesn't hurt when I do cable extensions. It's not, I'm just going to do cable rope extensions at 0 degrees of abduction, my arms at my sides. Why does it not hurt? Why does my elbow extension here hurt over my head, but not here? It's like, you lose that as an opportunity. It's like, oh, scapular position, scapular humeral rhythm, rib cage expansion, external rotation, overhead stability, serratus, teres minor, and then you can start to piece these together, and it'll happen again. It'll happen in a different, oh, now it hurts doing overhead press. Oh, okay, and then like, well, how do I fix this? Oh, my knees hurt. I love that one. I love a good knee pain story. My knees hurt when I squat. Don't just not fucking the number of bodybuilders that are like, I stopped squatting because my knees hurt. Like, all right. And then it's like they just do leg extensions now forever until they can't, and then they just go into men's physique and then they quit. It's like, what to use that as an opportunity? It's like, why am I having patellofemoral pain? Down the rabbit hole you go. So I think that's like more of like a meta answer as far as like the biggest mistake people make is they don't see the opportunity to learn. Oh, Instagram comes out with a new algorithm. All right, I got to post reels now because Zuck wants everyone to post reels. You'll learn that shit. But like, oh, my knee hurts. Fucking quad extensions. Hey, let's hop on the Smith machine. Like, oh, for fuck's sakes. And it's just, I mean, it's how much, like, do you love the outcome of training? Do you love the process of training to do it? And if not, fine, whatever. Post your reels and do your quad extensions. I don't give a fuck, right? But I think at a certain day, like, at a certain point, there are people who they want to pretend like they're about it. They like the lifestyle. They like the association of, being in this community. But you got to pay the price, man. Like, and the price isn't necessarily paid with the pain. It's like, what do you do with the experience or the opportunity that experience affords you? Are you someone to just go onto the quad extension or squatter, or are you someone to actually like, no, I enjoy squatting. I know it to be a beneficial part of this process. I'm going to figure it out.
Yeah, it's always the process that can lead to the greatest self-development and value, I think, throughout anything that we do. And we can get hyper focused on the outcome. Like, I want to squat X number, but a lot of that value that you could then have for yourself or share with others is getting through the process of getting up to that squat of X value. And that's even, yeah, like you said, people that come to me, like, do they care that I went and got my, my RDE and master's in nutrition? Like, most of the stuff that I use now, I didn't learn going to dietitian school. It's actually going through the process of like getting up to Olympia level. And that's why people come. So this is when you like see that, just like what I made J3 University for. It's like bridging the gap of like, yes, we have science and literature and textbooks and all that has value. But end of the day, you have to get in the trenches with this stuff. And that's when you're going to get the greatest knowledge set and application for yourself, or if you're helping others to apply it. So I think that's a great takeaway. And then for other people that are, experiencing these issues, stop just working around things till you have nothing left to utilize. Ask why. And that's part of the scientific mind as well. Like, if you're nerding out on all this stuff, it's like, ask why. Why does this happen? And that takes you down the route of trying to solve something. So Luke, did you have anything else for Jordan? Any other questions?
I think one just thing real quick, I know we're running out of time to wrap things up, is I know a lot of, and you've kind of touched on this already, but a lot of bodybuilders, for the sake of like continuing output purposes, will lean on these variations that externalize stability across the entire session. I think that's one of the biggest missed things that we can do, is the integration of these patterns into our program in like a scaled fashion where we can still continue to output, but we're working things in order to develop the capacity to eventually bring back the pattern that we were getting pain into in the first place. Do you believe that that's one of the biggest places where bodybuilders make mistakes, outside of just that initial, like, compensation of like, okay, this hurts, so I'm going to go to this, or I'm going to adjust the pattern, is not working back into that through proper program design? And do you still think that that's like the right logic in prioritizing output by doing what we can, but then like on the back end, possibly integrating these patterns that are going to allow us to move back towards that initial pattern in the first place?
Right. Yeah. So there's direct and indirect benefits to each exercise, right? Like, a squat is not necessarily, for most people, given the skill level in which I see squats often performed, the best exercise to grow quads or glutes, right? It's not. Now, there are people who have a high aptitude and a high skill, like a high skill in the movement, and they can do it effectively, and they can reap a similar benefit to, like, say, something like a leg press. But if you're someone who doesn't have that skill, I think the pursuit of acquiring that skill and practicing that skill in your training, whether I would assume prior to training your output, that'll lead you down the route of being just essentially asking better questions, right? So if you are trying to acquire the skill of a squat, and this is a skill that you are to practice, not an exercise that you are going to train for output, I think in attempting to fix and express the function that is required of you to squat proficiently, and maybe one day efficiently enough that you can actually sub it out for something like a squat in a particular block in your programming, that vein of thought will lead you down the rabbit hole of exposing the function in which you're attempting to express, and then ultimately will superimpose over not only obviously the skill you're trying to acquire in the squat itself, but that internal stability, that exposure of that function as it's rectified will begin to carry over onto more externally stabilized machines, because there's nothing to say you can't use internal stability in conjunction with external stability to really drive output. Right? People lie on a prone hamstring curl like a big cat over a tree. It's like, does your body work at all? Are you just paralyzed from the waist up and just your legs work? Like, why are you sitting there like the laziest piece of shit? Like, can you use a core? Like, just use a single core. Like, one core muscle to stabilize your pelvis, rather than just having this fucking thing cranking all over the place, right? So I think absolutely, the indirect benefits of going from exercises that maybe expose function, whether it's a barbell overhead press, pull-ups, dips, squats, and pulling on the thread and exposing the underlying function in which you're trying to express, that'll lead you down the hole of improving range of motion where necessary to get into unstable joint positions, which will then allow you to improve that exposure of function, integrate that into an expression of function, and then indirectly, that improving of that function exposure is going to superimpose and increase the output you have on things that are more externally stabilized, right? But it's like, look, you still need to like execute at a high level, right? The machine's not going to do that for you. And I think, and it's the same with squatting. It's like, just because you can stand on one leg does not mean the fucking squat fairy is coming to put a good technique under your pillow, right? I know plenty of acro yogi, top knot, no shoe wearing, 165-pound kids that can stand on one leg, put a bar on their back, they fold like a fucking lawn chair, right? So it doesn't license you the ability. It doesn't owe you anything, but it's the tools you need to integrate that into that expression of function. I think indirectly that exposure of function, improving that peripheral joint stability at the shoulder, the hip, and the spine will then allow you, if you choose to use it, to actually drive more output on your externally stabilized exercises.
No, thanks for that, Jordan. I think laying out that program design is what Luke and I have both looked into, and trying to start with instability movements and then move into more stable movements, and that just makes sense from a programming standpoint. But like we said in the very beginning, you have guys that like, well, I'm going to put my squat set at the very end because that's the hardest lift. But when you're already in your early tax, that's probably not the way to be programming from an output standpoint, but not just from output and moving, loads, but even from a bodybuilding standpoint of trying to get the most out of a muscle for hypertrophy purposes.
Yeah, I like the people's elbow as a finisher. Probably do more for your bodybuilding career than doing the squat as a finisher.
Well, Jordan, if people want to find you, where can we find you, get more information?
I can't imagine they would, but if they do,
they don't like you now. You talked a bunch of shit.
That's fine. That's fine. I love it. I'll give them my fucking home address. Stop by anytime. Instagram, the_muscle_doc. Prescript is where we run all the education courses out of right now. Next semester starts late March, early April. That's www.pre-script.com. So that's where you'll find me most days, is either on the Prescript site or on my own personal Instagram.
Awesome. Well, Jordan, great conversation, and truly appreciate having you on. I know your schedule's very busy. You're a wanted man. So appreciate you sharing some time with us.
Yeah, local police departments.
That's it. Well, again, this is J3 University. Until next time, we will talk to you then.